Welcome to Learning Pathology with Dr.Bhavana. Today we'll discuss about renal system. The first part is Introduction to Renal System. The structure of glomerulus is composed of an anastomotic network of capillaries, the fenestrated endothelial cells, visceral epithelial cells, mesangial matrix and the glomerular basement membrane. Glomerular basement membrane has three layers: lamina densa, lamina rara interna, lamina rara externa. This is the diagram showing you the mesangium in the center, endothelial cells surrounding the mesangium, the glomerular basement membrane, finally the visceral epithelial cells and the parietal epithelial cells. These are the cells of glomeruli, mesangial cells which have a contractile function, along with they also lay down the matrix and collagen. The second cell is the visceral epithelial cell which has podocytes or the foot process. The glomerular filtration rate. The glomerulus is highly permeable to water and small solutes. It is because of the fenestrated nature of the endothelium. It is impermeable to proteins. It is size dependent and charge dependent. The larger the size, they are less permeable. The more the cationic, they are more permeable. The size and charge dependent is because of the complex structure of the capillaries, charged nature of the GBM, anionic moieties in the wall and acidic proteoglycans in the glomerular basement membrane. Whenever there is any injury to the glomerulus, there is response in the form of hypercellularity by the mesangial cells, endothelial cells, basement membrane thickening, hyalinosis and sclerosis. Now we come to the immune mechanisms of glomerular injury. It can be antibody mediated, they can be circulated or cell mediated immune injury. This slide shows the immune complex deposition. It can be against the antibody or circulating immune complex or cell mediated. The in situ immune complex can be formed because of the fixed intrinsic tissue antigens or planted antigens. So this is the diagram showing the glomerular basement membrane where you can see the circulating immune complexes deposited at the level of the subendothelium. In situ complex can be formed because of the anti-GBM antibody or subepithelial deposits as in the Hayman nephritis. Coming to the antibody mediated. Whenever there is any antibody formed against the fixed antigen, example the collagen type 4 antigen, you have the antibodies formed. Or the antigens can be planted from outside, infectious agents or drugs. Or they can be present in the circulation like DNA, nuclear proteins. And also the immune complexes can be formed in the circulation and can be deposited. Lastly, we have cytotoxic antibodies. After the glomerular injury, the cells which mediate the glomerular injury are the neutrophils, monocytes, macrophages. The soluble factors responsible for the mediation are the components of the complement, cytokines, chemokines, growth factors, along with the products of the coagulation system and fibrinolytic system. So this is the diagram showing you the mediators, the cells, and along with that the cytokines and the growth factors. For the antibodies, there is immune complex formation, complement activation, leading to membrane attack complex, leading to the proliferation of the cells. In the T cell mediation, you will have platelets, macrophages, mesangial cells, K cells and NK cells. So this is the diagram showing the renal biopsy composed of glomeruli, tubules, blood vessels and interstitium. Finally, whenever you have to describe the glomerulus, it can be diffuse involving all the glomeruli, global involving the individual glomeruli, or focal, only a fraction of glomeruli is involved. When you have to call it as segmental, only a part of the glomerulus will be damaged. This is the classification of glomerulonephritis. They can be primary or secondary. Primary, you have acute proliferative, rapidly progressive, membranous, minimal change, focal segmental, membranoproliferative. Whereas systemic involvement or the secondary causes like SLE, diabetes mellitus and amyloidosis. Thank you.